You're watching Let's Chat.
Our friends over at Erlanger have got a new medical director of oncology and hematology. Let us introduce to you Dr. Sandeep Rajan. Dr. Rajan, good morning.
Yeah, hi, how are you?
Doing very well, sir. Give us a little bit about your background.
So, I'm an adult hematologist oncologist, and I have been all around the country and the world. I had trained in hematology oncology fellowship in University of Southern California in Los Angeles. And thereafter, I was a grant funded faculty there for a while. And then I went to Singapore and did my work at the National Cancer Center there, treating both solid and fluid tumors and benign hematology. Then I came back to University of Nebraska Medical Center in Omaha. And from there, for the last 9 years, I was in University of Tennessee in Memphis. And I was the medical director of the hematology clinics there and running the hemostasis thrombosis clinics. And now it's my pleasure to be in the beautiful city of Chattanooga to help this.
Tell me what attracted you to Erlanger.
So, since I was in the other part of Tennessee and in Memphis, I had watched Chattanooga with great interest. And this is a very a sort of emerging city. And interestingly, Erlanger is the only academic teaching hospital in the area.
Right.
And if you really look at it, about 1.5 to 2 hours circumference, this is the only teaching hospital. And so when I wanted to sort of, I was really interested in expanding my work here. And interestingly, it became a very good choice because I already knew University of Tennessee very well, and University of Tennessee College of Medicine Chattanooga has been providing the academic services here. And the position I joined was sort of a new one because there was also partnership with Vanderbilt University.
All right, tell me this. I know Erlanger and Vanderbilt Hospital have long maintained a medical relationship. Tell me what relationship Vanderbilt is playing with the Erlanger Hematology and Oncology program.
So for the hematology oncology program, Vanderbilt University is providing what is called the professional service agreement. That means that we are setting up a new core mass of hematologist oncologists who are Vanderbilt faculty, and we will provide the backing of Vanderbilt for clinical trials and all the support services. So the good part of that is very often earlier people had to go to Vanderbilt or do telehealth. Now we'll be physically here. We are all rooted here. I'm living here in Chattanooga. So are my colleagues who are upcoming. We'll be all here in Chattanooga providing very high quality academic care for our hematology oncology patients.
It's a very scary thing when a patient walks in to see an oncologist. How do you handle them when they're walking in your door for the first time?
We treat two kinds of patients, hematology and oncology. And sometimes everything looks like a scary cancer, whereas sometimes it could be a non-malignant condition as well. So first of all, the key thing is we'd like to keep our appointments fast so that patients don't have to wait too long for that question mark thing, what my diagnosis is, why am I seeing a cancer doctor? So we'd like to see patients as soon as possible, sometimes even next day, sometimes within a week, so that that waiting period is not there. And the first thing we want to do is we review all the records so that we exactly know what communication has happened between the patient and whoever is referring physician, and what are their key concerns so that we are sort of prepared as to what is the big concern the patient and the caregivers and the referring physicians would have. And next, it comes to basically breaking down in lay language and simple terms what they have and being very honest. So I'm very honest with my patients and I check with them what they want and if they want to involve other family members in decision making, and we make a plan together. And so far, I've been doing this for over 25 years, and I think that mantra has played very well to being honest with the patients and empowering them to make a decision after I have informed them of the various choices.
Find out more about what's going on with Dr. Rajan, some new and exciting changes to the program. Check out the website. That's Erlanger.org, Erlanger.org.